Rahman Rahim. Today we have the fourth lecture of inflammation. In this lecture, we answer the question of how the acute inflammation presented clinically. And also we discuss the morphological types of acute inflammation. Also, we know the end results of acute inflammation and the end results in this lecture. The vascular and cellular reaction account for the signs and symptoms of inflammatory response and increase the blood flow to the injured area and increase vascular permeability due to the accumulation of extravascular fluid rich in plasma protein, edema, and account for the redness, warmth, the color, and the swelling, the tumor that accompany acute inflammation. As mentioned in the previous lectures, especially in the first and second lecture, the vascular and cellular events that occur in the acute inflammatory process may lead to the signs and symptoms of inflammation. So when we see the swelling and the edema at the site of the inflammatory area, it will indicate there is extravasation of a fluid rich in plasma protein واللي يسميناه exudate at the site of the inflammation. And the redness اللي هو in the Latin word rubor due to the increase the vascular يعني congestion and increase the diameter of the blood vessels, opening of a new capillary bed at the site of the inflammation to increase the blood supply at this area. The warmth or the color اللي هو ممكن أنه feeling of heat at the site of the inflammation أيضا related to the increase the vascular permeability and increase the vascular blood flow. Swelling tumor, as we said, due to the increase the extravasation of the fluid that rich in protein accompanied by acute inflammation. The morphological pattern of acute inflammation, these depend on specific characters to lead to this pattern معين. تعتمد على severity of the reaction, the specific cause of the acute inflammation, and the particular tissue and the site involved by the inflammation. لأنه swelling, heat, redness ممكن هذه localized at any site of the inflammation. But there are specific pathological types of acute inflammation that occur in a specific site, in a specific area due to specific cause. So the morphological pattern depend on the severity of the reaction, the specific cause, and the particular tissue and site. Serous inflammation, this is one of this morphological type. The serous inflammation is marked by the exudation of cell-poor fluid. It means the fluid more than the cell. Injury occurs due to injury of the surface epithelium or due to the accumulation of fluid in the cavities that lined by the peritoneum, plural pericardium. So either due to injury of the surface epithelium or due to the accumulation of fluid in the cavity, pericardium, plural, and peritoneum. In this picture, on this slide, as you see, there is skin blister resulting from the burn. وذكرنا أنه الburn, it is one of the causes that lead to the acute inflammation. Or sometimes that occur in viral infection, represent of accumulation of serous fluid within or immediately beneath the damaged epidermis of the skin. As seen in this picture, microscopical under the, there is a space under the epidermis that due to the insult involving the skin, either burn or viral infection. The other morphological types that can be seen in the acute inflammation called the fibrinous inflammation. A fibrinous exudate develops when the vascular leaks are large or there is a local procoagulant stimulus. أهم شيء أنه from the name fibrinous inflammation we have a lot of amount of fibrin at this area. Higher molecular weight protein such as fibrinogen pass out of the blood. الفايبرينوجين يتحول إلى الفبرين and deposited in the extracellular space. The fibrinous exudate is characteristic of inflammation in the lining of body cavities, يعني مثل ما ذكرنا بالpericardium and in the meninges. Histologically, fibrin presented or appears as eosinophilic meshwork of threads or sometimes as an amorphous coagulant. يعني under the microscope, how we can identify the fibrin? The fibrin appears as an eosinophilic meshwork of threads or sometimes as an amorphous coagulant. As this seen in this, if the fibrin is not removed with time, it may stimulate the ingrowth of fibroblasts. يعني إذا بقى الفبرين راح يتحول إلى الفibroblast, ingrowth of the fibroblast and blood vessels, and thus lead to the scar formation or scarring. The picture on the left side, you see this is a pericardium, and there is a layer of this layer of fibrinous material, هاي grossly, while under the microscope F هو this meshwork eosinophilic material represented the area of fibrin formation. The other form of morphological type of acute inflammation, we have the purulent or suppurative inflammation called abscess. The purulent inflammation is characterized by the production of pus and exudate consisting of neutrophils, the liquefied debris of necrotic cells and edema fluid. The purulent inflammation is characterized by the production of pus. So we have a large amount of pus and exudate, mainly consist of, when we call it pus, it means dead neutrophil with debris and necrotic tissue with the fluid. So the purulent or suppurative inflammation, we have a large amount of neutrophil. The most frequent cause is infection by bacteria that lead to the liquefactive tissue necrosis, such as staphylococcus. So some of the bacterial infection have the affinity to produce liquefactive necrosis in the tissue and lead to the formation of the abscess. The main type or the good example for this staphylococci infection. Abscesses are localized collection of pus, وas mentioned البس هو عبارة عن collection of dead neutrophils مع fibrin or debris caused by suppuration, buried in a tissue, an organ, or a confined space. There is usually a zone of preserved neutrophil around this necrotic focus. يعني بالسنتر عندنا البص اللي هو عبارة عن dead neutrophil مع necrotic tissue مع fluid مع debris surrounded by preserved layer of neutrophil around this necrotic focus. Outside this region, there may be a vascular dilation and parenchymal fibrotic proliferation, indicating a chronic inflammation. So the abscess, if يعني last more than 10 days without evacuation, without treatment, ممكن يتحول إلى chronic inflammation. What is the indication for this reaction? لما نشوف عندنا fibroblastic proliferation with the blood vessels formation, This indicates change of chronic abscess formation and chronic inflammation. As seen here, this is a lung on the left side picture grossly. As you see, this small nodules or lesions that referred by arrows indicated of this is يعني abscess of the lung formation. Microscopically, on the right side, you see there is in the center, this is a low power under the microscope. We see there is a collection of pus that indicate the accumulation of dead neutrophils with fibrin, fluid, necrotic debris surrounded by a preserved area of preserved neutrophil and fibroblasts. Sometimes chronic inflammation surrounding this area with the blood vessels formation lead to the chronic abscess formation or change to the chronic process. The other form indication ulcers. An ulcer is a local defect or extravasation of the surface of an organ or tissue that is produced by sloughing or shedding of inflamed necrotic tissue. So the definition of the ulcer, it means sloughing of the lining epithelium or extravasation of the surface of an organ or tissue that is produced by sloughing of the inflamed necrotic tissue. Ulceration can occur only when tissue necrosis and resultant inflammation exist on or near a surface. الالسريشن can occur only لما يكون الانفلاميشن necrosis and the resultant inflammation exist on the surface layer. فلهذا يؤدينا إلى sloughing and the defect in the lining epithelium that lead to the ulcer formation. It is mostly encountered in ممكن نشوفه in the mucosa of the mouth, stomach, intestine or genitourinary tract. Other site could be seen in the skin, subcutaneous tissue of the lower extremities, especially in older persons who have circulatory disturbances that predispose to extensive ischemic necrosis. As seen this picture grossly, this an stomach with an rounded ulcer that have loss of the lining epithelium. This picture indicating of a chronic ulcer because it is more deep rather than to be a shallow. And on the right side, you can see the stomach lining mucosa. There is in the center loss of the lining epithelium with necrosis and the granulation tissue formation if we change to higher power. This is a gastric ulcer. This is one indication or one of the morphological features of the acute inflammation. After finishing the morphological pattern of the acute inflammation, now we change to outcomes of the acute inflammation. What happens after the acute inflammation end? What is the end of the story of the acute inflammation? This is what can be seen. About the outcomes of acute inflammation, we have the complete resolution. All inflammatory reaction after they have succeeded in eliminating the offending agent, it will be complete resolution occur. When the injury is limited or short-lived, لما يكون الانجري is limited or short-lived, or when there has been little tissue destruction and tissue damage, parenchymal cells can regenerated and complete resolution will be occur. So it depends the type of the injury, so unlimited or short-lived, or when there has been a little tissue destruction and the damaged parenchymal cells have the capability for the regeneration. While the other outcome, healing by connective tissue replacement by scarring or fibrosis. This occurs after a substantial tissue destruction. It means that large area or more deep area involved by the inflammation. So the healing will be by fibrosis and scarring. When the inflammatory injury involves tissues that are incapable of regeneration, as skeletal muscle, nerve tissue, all of these cannot have the regeneration capability, so the healing will be by scarring or fibrosis. And when there is abundant fibrin exudation in the tissue or in serous cavities, also it may end by the scarring and fibrosis. The other outcome الأكيوت inflammation ممكن أنه يتحول إلى الكرونيك inflammation, progression of the response to the chronic inflammation. Acute inflammatory response cannot be resolved as a result of either the persistence of the injurious agent or some interference with the normal process of healing. As seen in this diagram, acute inflammation may end by complete resolution, as seen in the right side, or may lead to the abscess formation والبص بعدين يصير بينه healing by fibrosis, loss of the function. Also, it may progress to the chronic inflammation, والchronic inflammation أيضا الend results مالته by fibrosis. يعني عندنا الend results للchronic inflammation by fibrosis, الabscess formation may end by fibrosis, أو sometimes some of the tissue لما قلنا أنه incapable of regeneration راح ينتهون fibrosis. As seen in this diagram, يعني هذا الخطوة اللي end with scar formation أنه بالبداية تبدي كالinflammation العادية أنه يصير extra vascular edema, fluid accumulation مع inflammatory cells. بعدين تبدأ vascular granulation tissue أنه new blood vessels formation, new blood capillary beds involved مع الفايبروبلاست and macrophage lead to the fibroblastic granulation tissue, يعني more fibrous tissue, more fibroblasts, more blood vessels with the inflammatory cells. The end results مالتها راح تنتهي بالformation of the collagen اللي هو الفايبر tissue and the يعني little amount of inflammatory cells that lead to the scar formation اللي راح نشوفها هذه بالhealing. The reference of this lecture from the basic Robin's pathology, وعندنا كذلك diagrams من الcore pathology. Thank you very much.